of as we plan and implement and the impact that eConsult will have. And so the emails that you all get from UCSF asking for your feedback is really to help you engage you in that process of what's our measurement framework. And then we have work that is underway with the Center for Connected Health Policy on what are the policy and reimbursement issues that are arising as we look to this wide-scale implementation of eConsult. And I hope that we'll be rolling out some information to you in the coming months about the results of their scan work and some next steps that we see on the horizon in the policy space. And this is really, again, all about how do we sustain this innovation and how do we create the conditions that will allow for the kind of scale that we want to, we hope that we get to. And then finally today, Bridget, if you could advance, I think we'll draw a little circle around technology, which is our focus today. What I often say about eConsult is that technology is an enabler of this. It's not the end game. The most important thing is the relationships, and that's what we know through the implementation science, but really you can't do it without technology. And so very early on, we heard from all of you how important it was that one of your key items of business was to look at the technology options and opportunities. And we wanted to do this both with you individually, but also at the field level, because you know the challenges are common. And so what we did was we partnered with Blue Path Health and we partnered with the California Healthcare Foundation to really look at a field level scan of technology options related to eConsult. So I want to thank our partners at the California Healthcare Foundation, Giovanna Giuliani and Chris Perrone. They actually connected us to Blue Path Health, and they supported this project along with us, provided funding to do the scan. And I think I'm very excited about the product that Blue Path has produced, and also excited that we are really intentionally, I have this arrow, making the connections here between the work that you are doing on the ground, the systems that you have in place that you're trying to work with, and this sort of broader field level knowledge that Blue Path has harvested, and we want to feed back to you and hopefully more broadly too as folks across the country seek to implement eConsult. So I'm going to turn now to John Weir and Blue Path, he's a member of the Blue Path team. Blue Path is a full-service healthcare consulting firm that partners with providers, payers, government agencies, think tanks, and health IT companies to develop policies and strategies to improve patient care and community health. They led this eConsult market scan and I think developed an understanding of the vendors and the product features and functions that you will see here today. Our speaker, John Weir, is a technical consultant with Blue Path. John has more than 18 years of experience working in the healthcare industry with software vendors, consulting firms, to provide innovative solutions. He's done a ton of work on widespread adoption of electronic health records and population health management, and he has been a great partner and I think listener as Blue Path worked on scanning the field and scanning with all of you for your needs in terms of technology. So I want to, again, thank our partners, California Healthcare Foundation, and thank John, Timmy, and his team, their team at Blue Path Health, and I'm going to turn it over to him.
Great. Thank you, Rachel. I appreciate the introduction, and thank you, everyone, for having us on the call today. We're excited to be able to review some of these market scan results with everyone on the line. And if we could move to the next slide, please. And just want to talk a little bit about what we're going to go through today, and really start off with just understanding from the field what some of the grantee priorities have been when looking at technical solutions, and then start digging into some of the market scan survey information. We have segmented it out into various components, and during the course of the presentation, I'll stop for a moment and address any questions that come up in the chat box, and then we'll leave sufficient time at the end as well for additional questions. And then just as we finish up, we'll be talking a little bit about EHRs and potential workarounds for the challenges associated with EHRs and eConsult. Then there's an appendix set of slides that everyone will receive with vendor profiles. We won't go through them in detail today, but we will make sure they're available for everyone. Next slide, please. So the process we went through was really to, first off, understand a clear definition associated with eConsult and make sure that everyone was on the same page with what eConsults are. And where we came out with that was really understanding that an eConsult is basically an asynchronous bidirectional communication that helps PCP, primary care providers, make a request for evaluation of a patient's condition specialist and have that information come back to be inserted into the patient's record and stored on an ongoing basis, really focusing around coordination of care, improving patient and provider satisfaction. And what we did for the purposes of the market scan was kind of a multi-tiered approach to understanding the market. We kicked things off with going out to various sites, getting on various phone calls, and interviewing grant-funded pilot organizations to get an understanding of where they are, what they're seeking in eConsult tools. And from there, we started going out to the vendor community and understanding what vendors were in play. The market scan itself existed of a survey that vendors completed out, and then using that survey, we validated by way of demonstrations from many of the vendors what they illustrated in the survey process. And today's slide deck and the associated Microsoft Word or PDF report are the results of that information. Next slide, please. So I want to start off a little bit just talking about grantee priorities. And I know we have Patty Porter from Alameda Health System on the call today. I'm not sure if we have Dr. Mike Aratow in panelist mode, but if that was possible, I know Dr. Aratow would like to speak a little bit about some of their priorities as well. But Patty, perhaps you could maybe kick off with just giving the group an understanding of some of the priorities that have been important to Alameda Health System when considering the eConsult solution and what direction you've taken to date.
Thank you, John. Good afternoon. My name is Patty Porter, and I'm the Director of Systems Optimization at Alameda Health System. I'm also the Project Director for our very exciting eConsult initiative at AHS. We started our journey a couple of years ago. Some of you may know one of our amazing primary care directors at Alameda Health System is a geriatrician named Evan Sivak, who unfortunately is not able to be on the call today. He has been really trying to encourage AHS to go into the eConsult arena for some time, and it was really under his push and desire for this to come about, we are really today. So I want to thank him in preparation for the comments I'm going to make. Along our journey, we've been working closely with the community health center networks in Alameda County to figure out what we as a community would want to do with eConsult. You know, the features and functionality of a shared system in which our community health providers, referring providers, would be able to use a system in which they can select eConsult as an option to our fine specialists at Alameda Health System and have those eConsults returned in a timely fashion. We had several meetings with them and actually did an analysis of what their wants and needs are, and I'm going to share that information with all of you today. And so I'm just going to share with you the top 10 priorities as agreed upon by Alameda Health System and our very important community partners with eConsult. One of the high-level requests was actually to have the ability to have some sort of decision support embedded in the eConsult system so that the referring provider would know exactly what information was needed for the eConsult by specialty. Some of us refer to these as expected practices. That was very much a high need. They wanted to have assistance with decision support by specialty. They wanted to have the ability to know exactly which information needs to be included in the referral for the visit to occur or for the eConsult to occur. They wanted to use industry-based standards for CCDAs and lab tests. They wanted to have workflows embedded in the eConsult system so that the referring provider or the specialist provider can see exactly where the status is for their patients. And they also wanted to have, hopefully, the opportunity for the referring provider to make a recommendation for if they would prefer eConsult or not, as opposed to having a system in which eConsults went in one direction on one system and the more traditional person referral occurred in another system. So the idea of having one system for both eConsults and standard referrals was most desirable.
Great. And any more thoughts or comments, Patty? We may have lost you.
Oh, okay. No, I'm here. I just,
okay.
Yeah, I can go down the list, but they get really into more of the features and functionality of the system at a fairly granular level. I'm happy to share the information with anyone if they're interested.
That'll be great. So perhaps in the Q&A section, we can maybe see what additional pieces we can go through there. And greatly appreciate you kind of outlining, some of the priorities. I know Dr. Arato, I think you're on the line now. Perhaps
Can you hear me?
You've been very focused. Yes, so you've been very
Excellent.
focused on e-referral, but also considering the e-consult of late and how it kind of tiers into the process. Do you want to talk a little bit about your experience to date? Having been recently going through the vendor selection process outside of the EMR.
Sure. Just to really sort of highlight some of the priorities that on this list here that we were sort of concerned about, similar to Alameda, but more briefly, we actually, first of all, I'm Mike Arato, I'm the Chief Medical Information Officer at San Mateo Medical Center, and we actually started on this journey several years ago and had several false starts, and we were trying initially. We have an EMR, and because we're sort of a closed system, and all of our specialists are really working on the same system, which is eClinicalWorks. We had a pretty good communication or back and forth between them. It was not optimal, and eConsult in its form for just the platform communication still was needed, but we had wanted to go a little further, and that's what the sort of what we call the e-referral, where we added a rules engine. And so we started down that path, and it was difficult because we were trying to bring in a couple different third parties to make this work. So that when it came down to it, I think one of the priorities was we have been living in multiple systems here, sort of the best of breed type of configuration for EMRs, and we had seen other, and I had seen other initiatives and tried innovations where if we didn't have really good integration with our workflow, that this would not fly. And so one of the important things to us, which is at the top of the list here, is that if we can't get it built right within the EHR, which we actually had tried to do during our initial attempt several years ago, that would have to be as tightly coupled as possible. And that means, as you said, single sign-on was really important to be able to do that, and to be able to transfer as much data back and forth between the consult system, the consult system plus the EMR, so that there would be no redundant data entry. And so that was really one of the priorities. And then the other one, because we do have some outside partners that will be referring into us. We give specialty care for some of the local community clinics. We wanted to make sure that this was something that could be used by them, that was easy, it was cloud-based, and that if there was the opportunity, it could also sort of fit into their workflow rather than having to go to two separate systems. And so those were sort of the two major priorities.
Great. Thanks, Mike. Greatly appreciate it. And I think just to touch on a couple other points here, you know, as folks are considering some of the capabilities of eConsult systems, you know, if we go down the list here, you know, we talked a lot about single sign-on and embedded data, bi-directional data transfers, and the ability to pull and push data in and out of the EHR. I think some of the other components to think about is if you're in an area where there's low access to specific specialties, one of the things that we saw was that some of the eConsult solutions are actually providing supplemental specialist panels who can fill in gaps in specialist demand in a community. So they're accrediting and running specialist panels as part of their software as a service process, and making them available if and when customers need that, which is a pretty interesting model as far as sharing specialist capabilities within regions that need it. We'll talk a little bit later about interim solutions, but in a nutshell, anyone who's been focused lately on meaningful use stage 2 for EHR should be fairly familiar with the direct messaging protocol, and we'll talk a little bit about how that, you know, is an interim solution that has lots of holes in it if you want to track and report and do various things, but it can be an entryway into eConsult messaging back and forth, you know, while selecting the solution. And then looking at, you know, if the systems have the ability to code for billing purposes and be able to incorporate patients in the communication process. And we'll see that there are some limitations around that. So next slide, please. So as we went out to the market, we looked at vendors, and we segmented those vendors into three areas. First off, electronic health record vendors, so anyone who has a full functioning EHR system in which an eConsult solution might exist. Standalone eConsult vendors, and so vendors who are very focused on eConsult and in some cases e-referral capabilities, but very niche in that segment. And then health information exchange and or enterprise solutions. And so non-EHR vendors that provide healthcare software solutions for HIE, population health management, care management platforms, or even in healthcare, and we looked at those. And we ended up reaching out to 24 different vendors across the market. We'll show those I think in about 2 slides. Our response rate, flip into the next slide, was about 40%. And we had we reached out to 12 standalone vendors, 9 enterprise vendors, and 5 EHR vendors. And our response, shocking enough, was that we did not get any responses from EHRs. We did have one vendor, NextGen, who did communicate well with us in the process and indicated that they are working on a solution and need to, you know, evaluate and build something that would really fit the need for eConsult. And standalone solutions, we heard back from just under 50% of them, and we heard back from just over 50% of the enterprise vendors. So next slide, please. Of the responses, the feedback was actually very encouraging as far as common requirements. And like I said, during our interview process, we went out and we polled and listened to understand what are some of the requirements from a feature functionality and infrastructure capability that some of these software solutions are providing. And having gone through that, we saw that the majority of vendors were meeting over 90% of those common requirements, and you'll see them today. Over the last 6 months, some areas that we have seen some great strides in with some of the solutions has been in the integration and embedding of their solutions with EMR vendors, or being able to interface with those EMR vendors. A lot of the standalone systems are making great strides in that area. And some of the standalone solutions are also providing some great automation as far as allocations of consults and who gets the eConsult sent by the primary care provider, using different algorithms associated with communication frequency, ratings based on feedback from the PCPs and the responses they get from specialists, and a variety of other components that help them create algorithms that push eConsults out to different specialty panelists on an as-needed basis based on what the primary care providers are seeking. I think I've covered a couple of the other pieces on this particular slide as far as lack of reimbursement initiatives driving some of the lack of sophistication associated with billing and financing, reporting and information sharing there. So let's move to the next slide, and that's going to be around vendor details. So like I said, next slide. Sorry. Here are the list of vendors, back one, list of vendors that we received responses from. American Well, Arista MD, Eceptionist, MedUnison, Orion Health, Referral MD, Rubicon MD, SafetyNet Connect, Salesforce, and Stella Technology. So it's actually a pretty nice variety of solutions that we got responses from. And some of them are more known than others. And what we found is that organizations have been in business for a variety of different years, everything from 14 plus years, all the way up to maybe being in business for the last 2 or 3 years, and a lot of really interesting technology capabilities being pushed by some of the later stage vendors. Next slide, please. So the first component that we looked at was system infrastructure. We kind of broke that into 3 areas. First off, architecture. Secondly, privacy and security. And then understanding what type of pricing model the organizations run under. We did not, for the purposes of this market scan and for the sake of impartiality, we did not get into specific pricing discussions with vendors. And so as you go out to the marketplace and look at different vendors, those will be discussions you'll have to have. But the nice thing on price modeling is that everybody is offering a software as a service subscription model. There are a couple of vendors out there who do have the ability to offer a perpetual license similar to many of the EMR and other software tools that folks use today, that type of model. But backing up to architecture, some of the findings we had, obviously software as a service, cloud-based models were prevalent, and we did come across 3 in the pool who do offer a localized model. So if your healthcare organization prefers to host its own software as opposed to having it out in the cloud, that's an option with a small handful of vendors here. As far as accessibility to their solutions, bandwidth requirements, hardware requirements, and software requirements were actually very lenient or slim, I should say. Standard bandwidth requirements, if you can get to the internet, and are using a browser in your healthcare organization, you have the ability to get out to most of these solutions. And then likewise, hardware requirements, since it is often a software as a service solution, and they're very light on actual PC or hardware requirements. And the requirements you see here for the likes of Stella Technology or Salesforce, for example, are more focused on if you were locally hosting what requirements would you need to do that local hosting. Excuse me. And then on the privacy and security side of things, we looked at data encryption, secure messaging, user authentication, and audit trail reporting. And fortunately enough, all vendors, not surprisingly though, are all capable of meeting the requirements we set forth. So is the data encryption encrypted in transit? Is it encrypted at rest? Most vendors, or all vendors, got back to us and said yes. Messaging is secure. User authentication is at least with a user ID and password. And all transactions going on in the system are audited. Next slide, please. So as far as core functionality, and what I mean by that are specific features or functions that are required for eConsult to be driven, essentially. So we looked across the market and said, hey, we need universal patient ID matching, and that gets back to integration with EMRs and being able to go from patient in the EMR to patient in the eConsult solution. Payer data transmission, and on both segments, many of the vendors responded positively. Patient searching, with the universal patient ID, can I either click a button in my EMR and pull up my eConsult and make sure it's still on that patient, or do I have to search for a patient? And if I have to search for a patient, many of the tools had that capability. Template customization by specialty, that was a big thing for many folks, and the vendors all come back and indicate that they can customize templates by specialty. We did not get into further detail on this, but some vendors do have the ability to even go down to the user level, which I think has its pros and cons, but definitely at the specialty level, templates can be customized. From a message routing perspective, and we looked at message urgency, and can I prioritize messages? Can we route messages using a rules engine? And can eConsults be declined or redirected by a specialist? And those were the three areas we looked at as far as routing, and again, universally, the vendors came back with the exception of 2 cases on the rules engine component, indicating that yes, they can. As far as the routing of the rules engine, again, that can be sophisticated in many instances. It can be rather simple in many instances, and I really would urge folks, whenever you are looking at that capability, to have really in-depth discussions with your vendors and to understand, how they plan to meet your needs. Provider status change notices, and that's universal. So let's say your specialist is going on vacation and you don't want them to receive information, for a week or 2. People can be turned off and turned on, and messages can be rerouted. Clinical guidelines was another one, and that again, similar to routing rules engine, this was variable by vendor. Some vendors, such as Arista MD, have licensed very detailed and heavily used clinical guidelines and have them embedded within their tool, whereas some vendors will let users basically just build them up themselves and make it part of the templating process. So you have varieties of depth of capability across the use of clinical guidelines within the products, but they all indicate it, with the exception of Rubicon MD, that they have that capability. Rubicon MD is actually a pretty interesting vendor. I won't go into them in real detail, but I'll be happy to take questions on them. But at some point in time, they have a very intricate engine in the background driving a lot of their automation. And so with the clinical data that gets pushed through their system, they have the ability to not necessarily need a lot of work around this area. So kind of interesting. Moving on, from the billing and referral management perspective, or pushing to referrals, pre-authorization routing and billing coding. They have the ability to capture billing codes, many of them. They don't have the ability to report on them and do anything with them. Has been something that we've seen. Pre-authorization routing, over the course of the last several months, that has actually been maturing in some of these solutions, and you'll see here that many of them did respond yes. We didn't get a chance to prove that out in great detail in the demonstrations, but they did indicate that it was available. And then finally, in core functionality, patient inclusion, we've started to see a couple of the vendors create the ability for the primary care providers and the specialists to not just collaborate together, but also in the feedback loop, open it up upon approval by the primary care provider to include the patient with summary information. So that's kind of an interesting next phase of where eConsult may be moving from a communications perspective, as we think of patient engagement and where that set of capabilities is moving in the technology world. So next slide. Let's see, and that is integration. We looked at integration pretty heavily. If we could have the next slide come up, please. And we looked at it from the perspective of systems integration, treatment history data, data integration, scheduling data, and specialist access. So from the systems integration, everyone indicated that they have the ability and have integrated with an EHR and in some cases an HIE. Some of the vendors have also illustrated the ability to have be embedded within the EMR and have context sensitivity across systems with their patient, and single sign-on hand in hand with that. So that's something that has evolved rather quickly over the course of last year. I think if we were looking at this in January 2015, we would have seen a lot of no's on the single sign-on column across the vendors. So momentum there. The data format supported. Anyone who's technological on the call today, we'll see that CCDAs, HL7 messaging are all fairly standard across the capabilities as far as trafficking of data, and with that, API pipes between systems is commonly used, in addition to standard HL7 interfaces. From the treatment history data component, we looked at can they provide us with demographics, medications, orders, results, data, clinical documentation, and then have the ability for specialists to upload documents back to the PCP. And as you can see here, many of them have the ability to do so. Scheduling appointment linkage was a little less robust, and something that we saw as more of a customization by many of the solutions that we reviewed. And then specialist access, I mentioned this a little earlier in the call, and some of the vendors do offer the ability to maintain a specialist network for the organization or for their customer. And so back to my earlier comment of if you have a dearth of specialists within a certain region and you need to supplement that, some of these vendors have that capability. So I'm going to stop for a moment and see if any questions have come through just yet before I move on.
Thank you, John. Everyone, if you have a question to pose to any of the panelists, please feel free to type that in the chat box or question box. John, I think you're okay to move forward.
Okay, great, thanks. Let's see, so moving on to the next slide, or two slides, we'll go to services and support. And we polled the various vendors to understand what their implementation services entailed, and what training services they offered. And there really was not a lot differentiating them. They all go through a pretty standard implementation methodology, offering project management. And from a training services perspective, it's quite exciting to see that they offer a pretty wide variety of training services. So everything from in-person instructor-led training and to live webinars, recorded webinars, and and as you think about the rollout process, recorded webinars, online training, and access to a knowledge base for polishing up on use of the system, bringing in new hires and getting them up and running on the system, all become very useful tools. And then from an implementation timeline, while many of the vendors indicate it really depends on the size and structure of the organization and how quickly things can move, the rule of thumb that we found was that anywhere between 60 to 120 days was really a commonly mentioned time frame across organizations. There were quite a few that indicated 60 to 90 days as well, but again, it's really going to depend on a client-by-client basis. Let's see, next slide, please. So we provided this slide just as a basis to give folks an understanding of some of the notable characteristics that we found during the demonstration process of vendors. I'm not going to go, for the sake of, we're about 15 minutes left, and I want to leave time. I want to leave some time for questions in the end of this. But we had good demonstrations from all vendors. There was really no one that let us down as far as their survey questions not being paired up to their demonstration capabilities. Of note here, I do want to mention that we did not get to demonstrations with Orion Health and Salesforce, and they would have had to do some customization in order to get that for us, and so we opted not to pursue that for the sake of time on the project. And again, if you think about the three market segments we looked at, if you think of American Well, Stella Technology, just at a glance here, they come up with very robust enterprise-wide solutions that go way above and beyond eConsult. So as you're looking at the marketplace, that's one thing to keep in mind. What other care management programs are you running? What other solutions might you be thinking of as an organization that might slot into in and around eConsult, to supplement other programs or projects, as opposed to standalone eConsult. So that's a pretty big consideration, I think, for many organizations as you look at this. But again, the niche vendors, the standalone vendors, offer up very robust, focused eConsult solutions here. And if there's any comments or questions on any of these vendors in the comments on this slide, I'll take questions on them at the end of the presentation. And then next slide, please. So lastly, I want to just address the lack of EHR vendors. If we could flip the next slide, please. I want to address the lack of EHR vendor response. And it was quite surprising to us that no one got back to us. We know that a company called Pareto works with Allscripts, for example, and was a partner with them for referral and consult capabilities. But it really turned out EHRs just did not play ball with us on the survey. So we went out and we looked at, well, how do EHRs do this? And really the only option that we came up with outside of full-blown customization and building of specific templates was using the direct messaging protocol, where you could, if you're assuming your EHR is meaningful use stage 2 certified, and that there's a health information service provider involved as far as routing of messages, you could push secure messages from your EHR through to HISP and out to another EHR. Some of the issues with that is that that messages are done on a one-to-one basis. So if I want to track, if I want to report, I want to be able to do analytics on the use of eConsult within my organization, I lose all that But if you had to use this type of capability as an interim solution or, as a stopgap, it's something you could consider. And on that note, I wanted to just spend a second or two, or a minute or two, I should say. Patty, if you're still online, maybe talk a little bit about how your organization's addressed eConsult to date and where you're thinking of going as you evolve into cross-EMR communications.
So, so we actually have operationalized eConsult here at Alameda Health System in June of last year with 3 specialties. We've been able to do it within our EHR, which is NextGen, understanding that eConsult is only available to providers who are on NextGen within our larger health system, which includes most of primary care across the system, with the exception of providers on one of our campuses who are in the pediatric and OB clinic. We had to get very creative with NextGen. There's functionality within it in which you basically can message back and forth between a referring specialist and a referring provider and a specialist, and we've been able to do that. But for those of you who know NextGen, within the current configuration you cannot attach documents, and that becomes quite problematic, especially for highly technical referrals such as neurology. The reporting capability within the NextGen EHR, given the way that we've built the system, has been very problematic. You can get the system to function a certain way, but if you want to get the data out at the other end, it's been very, very challenging. And then, of course, the problems associated with optimizing both the referring provider message to the specialist and minimizing the number of clicks and making that process very efficient. We are continuously evolving the user experience with it, both with the referring provider and the specialist. So it's a work in progress. It's working. It can work within the EHR. You have to have smart technical support to do this. Our long-term plan is really under discussion. As John alluded to, NextGen among the EHRs does not have a solution for this outside of something they call NextGen Share, which I'm not an IT expert. I'm a nurse. I consider sort of that technology right now more of a glorified secured messaging system, so it doesn't really interact the way we would want it to. So we're in conversation with NextGen right now about how we can use the system we've developed in our EHR in NextGen and reach out to our community health centers. They are also NextGen users, and figure out how we can do eConsult more at an enterprise level than just within our system. So work in progress. If anyone wants to contact me to find out more about what we're doing, I'd be happy to speak with you.
Great, thanks, Patty. Greatly appreciate it. And on that note, we're really at the end of the presentation for today. I do want to point out that in your slide deck, the presentation does go on, and slides 20 through 29 provides a detailed vendor profile on each vendor. And then slide 31 does provide a list of all the vendors we reached out to as part of the survey. So if you have a vendor on there and you notice that they didn't respond, one of the things we seek to do is kind of keep this process alive and continue our understanding of vendors. And if there's someone on there that you're looking to gain some further insight on eConsult with, and we do have use cases. We have a variety of materials that we can share with them as they consider how things would fit into their solution. So I'm going to open it up for any questions at this point. We've got a few minutes left, and see if anyone has any thoughts or comments.
Thank you, John. And just a reminder to the audience, the slide deck that John's referencing was sent out via email Monday. and will also be available again in distribution, as well as the recording of his presentation and input from the Alameda Health System. So thank you as well, Patty, and to Dr. Aratow. Appreciate that, and to Rachel. Any questions that the group may have, please enter those into the question box or the chat box. We're happy to field those for you and curate any questions that you may have conveyed to our panelists. John will just give it a minute or two. The presentation has been quite thorough. I think you've given everyone pause and time to digest. I know in a number of different scenarios, it's been talking a great deal about the single sign-on option as well as this advancement. So thank you, Patty, for commenting in your application about how you're using messaging or considering that moving forward. One thought that did come up with a few of the grantees that I've been working with as well was this issue of how do you explore in the starting stages, in the planning stages, this technology adaptation across distinct organizations. So are you curating or basically facilitating dialogue from a specialty group to multiple primary care locations that aren't necessarily linked, they don't have the same system, and literally have different organizational network structures? Care to go deeper on that a little bit, John, for the group?
Well, and that's been one of the hurdles that we're seeing as far as cross organization, multiple system, handling multiple systems, and moving eConsults from, let's say, EHR1 to EHR2, and EHR3. And what we've found is that this is where the standalone solutions and the HIE enterprise tools have really come into their own as far as that capability. And we haven't truly during the demonstration process seen a live demonstration of how different organizations are managing the distribution of eConsults, and simply because they need the vendors need an EMR to be able to illustrate that. But it is something that really has to be taken care of on the integration side of things, and getting the stakeholders to be able to open up essentially the pipes in and out of their EHRs for that to happen. Now, the nice thing with the eConsult solutions is that because they sit in the cloud, access across organizations and configuration across organizations is a relatively, I'll say a relatively straightforward thing, with the qualification that obviously there needs to be policies and procedures all tied to it, and stakeholder involvement in that. But this is kind of where the hopefully the EHR world will go to hand in hand with some of the standalone HIE solutions, in that they can operate across different organizations that are using different EHRs a lot more effectively in the future.
Thanks for that, John. We have received a couple of questions, so let me pose those to you. One comes from one of the county grantees who's spoken with their managed care Medi-Cal plan and realized that the Medi-Cal plan, the health plan, is going with Rubicon. Knowing that and knowing sort of what the pros and cons are for that, the grantee is asking, are there any particular areas they should be looking out for as far as the plan going with that, whereas the delivery system needs to consider how it works with the plan?
Actually, so Rubicon MD was a pretty robust solution for eConsult, and I think I know what county we're talking about. I would just emphasize that as you work together to build up any clinical guidelines that would be built into the system, to really look hard at that and make sure that that both the primary care providers and specialists are heavily involved in that whole process, and the vendor will have a basis of information associated with that, and they've been making great strides in that area. But I think getting your local clinicians involved in that process is going to be very important to get sustained adoption of the system. Hopefully that helps.
Great, thank you, John. Another question that came in is actually more a global request. And from your perspective in your scans, John, looking across the grantees, they're starting the early adoption and implementation mode with some of those. There's a request on the table if you've seen any trends on those, and Rachel and PA team, I throw this request to all of us. There's a request on the table for shared lessons learned across the implementation of early adopters implementing eConsult systems. So, John, in your scan and in your conversations with all the grantees, what do you think are probably the top 3 lessons learned?
Top 3 lessons learned. I think, back to, I finished the last comment with clinical guidelines, and I'll probably start this one with the same thing. I think, where we can, so each community is going to be different, but there's going to be the ability for some clinical guidelines sharing and conversations around lessons learned, how best to convene groups, how best to leverage their time. I think that's going to be one important thing. I think in the systems, system selection, I think, if I think about lessons learned, but also information sharing, there's scale associated with that as far as sharing, the ability to maybe illustrate vendors en masse to different groups as opposed to county by county doing it on a different basis, if that makes sense. And I think top 3, I would go back to defining the really early stage, defining how you're going to communicate across EHR. So it kind of goes back to an earlier part of the discussion, but really taking care of that up front, and so that you go into the vendor conversations with a really clear outline of what needs to happen in order for the vendors, or the group of vendors involved in this case, to be able to talk to each other and make something happen relatively fast. We all know that vendor integration projects can get bogged down in a variety of different issues. So where there's lessons learned associated with that, I think a lot of the early adopters have been going through different, different experiences with their vendors and data integration. And I think there's still a lot more lessons learned to be had there, but I think that's going to be a third area where folks can benefit with sharing some of that information.
Rachel, this is Patty. Can I just make a quick comment?
By all means, Rachel.
Just the 2 other, lessons learned I would like to add to John's list are: make sure you're involving your referring providers in the demonstrations. Their user experience with these systems is critical. Maybe that's self-evident, but I cannot emphasize how important that is. If the system is crummy or difficult or too complicated, not intuitive, they simply won't use it, especially if it's a standalone system. And the other one is, you look closely at options. Be very clear in your minds about what kind of reporting information you're going to need out of a system. That's been very challenging for us, and I think as you plan, you should always plan to evaluate, and that I think should help to really drive your decision about which vendor you'll go with, the one that meets your reporting needs.
This is Delphine. I just wanted to pipe in and echo what Patty just mentioned. I think involving clinicians very early on, not only as clinical champions to champion decisions that have been made, but also to focus on workflow and make sure that the solution enables common sense workflows in the clinical setting, while still acknowledging the fact that workflows will have to change. And so involving the clinicians in change management and trying to encourage everyone move forward in this together, I think is a huge lesson learned.
That's great. Yeah, that is really important. Thank you, Delphine and Patty. Bridget, any other questions for us?
I think we have hit all of the highlights for all the questions. John, one last call to all the folks. If you have any other questions, please feel free to type those in. All right. Seeing none, I thank my panelists for their patience with our network and slide advancement. As I said earlier, our recording of this webinar will be distributed out to the attendees. The slide decks themselves have been distributed. We'll do that again, and you can see the attachments that John mentioned with the additional slides that go into vendor-specific detail. Additionally, a Word doc was sent out, or a PDF of the final report as is from Blue Path that summarizes their findings, was also distributed. We'll share that as a resource for the team. And as John said earlier in his presentation, this is an evolving process as you move forward. I know all the grantees are at different stages of technology implementation, but as you move forward, if Blue Path and their expertise on systems can be of resource or of assistance to you, I know feel free to reach out to John and team for follow-up questions or any detailed information. With that, I think we are ready to go. With your deference, I thank you all for staying a little bit over our time, but have a wonderful day, and I wish you all the best.
Thank you.
Thank you.